it's important to understand who our patient is individually, right? What does the timeline look like for that patient? When do they remember feeling well? When do they remember maybe there's an inflection point or inflection points that something shifted for them, right? Because many patients with fibromyalgia identify stress or stressful event or events during their lifetime as a pivotal trigger for their chronic pain. We all know that the body, we manifest, mental, emotional pain as physical pain, right? It is a messenger to allow us to look deeper within ourselves and to address something deeper, right? So it's so important for us to really understand our patients at multiple different levels, as opposed to just, okay, let's look at your painful points. Let's measure your painful points over and over again and not really look at anything deeper, right? That's not helping our patients. So we know that there's something related to stress. Lower cortisol levels have been reported in many stress-related disorders like PTSD and chronic fatigue syndrome. Higher than normal cortisol levels can also impact the way that we feel, right? So this particular study here was looking at specifically cognitive problems and its relationship to cortisol levels. And so this particular fibro group in the study had more subjective cognitive complaints and performed poorer in objective cognitive testing and memory. So there's something to be said for, we already know that there's, impairments at the level of the brain. And how it relates to stress is that the diurnal cortisol levels of patients with fibromyalgia tended to be lower, especially at 30 minutes after awakening at bedtime. So they're the highest time and the lowest time. Those are the times where people had the worst problems with cognitive function. This is just a simple schematic for those of you who are visually inclined. Again, we look at the causes of fibromyalgia here, as we've already discussed many times. It causes decreased levels of melatonin. Again, that's related to the serotonin. That causes, obviously, decreased serotonin as well. We have more pain. It affects our cortisol function. That leads to more inflammatory byproducts like tumor necrosis factor alpha. That leads to the painful syndromes that we feel, the hyperalgesia. That causes more elevated levels of cytokines, and that disrupts our circadian rhythm. And that really is part of the problem, is that stress causes this to happen, and then all of the byproducts of what's going on internally exacerbate the stress and cause an internal stress that we don't even know that we're feeling, right? And I think that's something that we forget about, is that when our body is managing inflammation, it is a stress. The body is trying to manage it by releasing things like cortisol to suppress inflammation, to reduce that in the body. And over time, it continues to diminish the cortisol levels in the body. And that typically is going to exacerbate the problems of fibromyalgia, and on and on and on it goes. So that's why it's important to stop this cascade in its tracks, to identify why the chronic stress is there to begin with, or go back in time to try to address it. There is some type of relationship between blood sugar imbalance and fibromyalgia. Patients who have diabetes or metabolic problems, oftentimes it does increase the risk of cognitive impairment, and that shines through also in fibromyalgia. You can see that insulin resistance potentially is a risk factor for cognitive impairment or brain fog or other types of situations in fibromyalgia. There's a bidirectional relationship between pain and insulin resistance. This was in a rat study. So the higher levels of pain was associated with a higher degree of insulin resistance, or tending more towards diabetes. This study here demonstrated that insulin resistance induced by fructose reproduced several aspects of neuropathic pain, suggesting that the hypersensitivity that patients with fibro experience could be triggered by fructose feeding. I find this extremely relevant, especially with the dramatic rise in consumption of high fructose corn syrup. We're not talking about fructose from fruit to a high level of degree that still can impact our fructose intake. We're talking about high fructose corn syrup from sodas and other things that are sweetened, right? We know that fructose causes insulin resistance in healthy people. They've demonstrated that in studies. It also causes fatty liver. It also leads to insulin resistance in rats within like 6 weeks and cause them to become obese. So it also seems to be related to this neuropathic pain. So you want to help your patient feel less pain, stop having them consume sweetened beverages, especially high fructose corn syrup. Patients with fibromyalgia also belong to a distinct group that can be segregated from control groups by their A1C levels, which seems to be at least to some degree a surrogate marker of insulin resistance. So the higher the levels of A1C, sometimes that correlates to a higher sensitivity and more symptoms of fibromyalgia. So do you think we need to be looking at kind of the whole kit and caboodle, looking more at a functional lab standpoint? Yes, absolutely. And looking at the relationships between blood sugar regulation, insulin, fasting insulin, and how that manifests for these patients. All right, so I'm going to spend a few minutes on this concept here because I think it's very, very important in fibromyalgia. That's mast cells. Fibromyalgia can invoke localized inflammation in the hypothalamus. The hypothalamus, we also release cytokines. That what we know is that these cytokines impact the way that we feel pain, right? The nociceptors, those are the receptors found throughout our body that allow us to have more or less pain. So these cytokines in particular, IL-8, IL-17, IL-6, TGF-beta, some of these things are released by the mast cells. You can see mast cells secrete IL-17 also, which is related to autoimmune problems, by the way. So that's not that surprising. Contribute to the development of Th17 cells. That is going in the wrong direction for our immune system. What we think is that mast cells are potentially the immune gate to the brain and how we respond to and feel pain, hypersensitivity to pain. So this is a very interesting slide here showing that the mast cell activation at the level of the brain here causes the release of multiple different chemicals and hormones into the body. Number one, corticotropin releasing hormone. That is the hormone at the level of the hypothalamus that signals the adrenals to produce cortisol. That is signals the adrenals to think that you're stressed, and that activates that entire pathway that we just talked about. Histamine, which again is released at the level of the gut and elsewhere throughout the body, is inflammatory component that can sometimes also activate these things called the microglia. The microglia, which also produce inflammatory cytokines. And lastly, on this picture, what I want to show you here is that this red line stimulates pain signals. So the mast cells, if we go all the way back to our picture from before looking at the gut, there's a direct connection between what's happening in the brain and what's happening in the gut from the perspective of how we experience pain. So again, patients with IBS, where do they feel pain? They feel pain in their gut. That's what that other slide was showing. But these particular chemicals and the things that mast cells are producing also cause the pain signals to be generated along these pathways along the spinal cord. You can see the pain signals are generated and travel up to the brain. And guess what? The pain activates the entire thing over again. So that is also a vicious cycle. Mast cells, again, if you look at this picture here, activate or communicate with microglia. These things are responding because of histamine and tryptase and other types of inflammatory cytokines. The microglia can also be activated by stress, right? So this same concept here, we're also being activated because of stress. So then the microglia activate these things called astrocytes, okay? And one of the critical functions of astrocytes is the regulation of neurotransmitters. That's the little chemicals found throughout your body that help to allow you to feel balanced, right? We have excitatory neurotransmitters, we have inhibitory neurotransmitters. There should be a healthy balance between the two, right? For you to feel like you're at homeostasis. What if you have too many excitatory neurotransmitters? Things like glutamate, that can make you feel agitated, that can make you feel stimulated, that can make you feel more pain, right? And that's really what glutamate can do if you have too much of it. And so what we think is that the excess of glutamate in a process known as glutamate excitotoxicity causes hyperexcitation of neurons. And that is what we think accompanies several different inflammatory and neurodegenerative diseases of the central nervous system. What we know about glutamate is that it needs to be cleared from the space after it's been bound to the other neuron to cause its reaction. And so the mission of glutamate clearance is primarily by astrocytes and mediated by these things called glutamate uptake transporters, just like the activation of any other neurotransmitter. So what happens is that, unfortunately, microglial activation of astrocytes causes the astrocytes to lose their ability to metabolize glutamate. That's a very, very important concept because that was two varies. Maybe I should put three varies because glutamate is excitatory in nature. It wreaks havoc inside the body. And you can see here, this particular slide shows that various imaging techniques have shown that elevated glutamate levels and lower levels of something called GABA, which is our primary inhibitory neurotransmitter. It's inhibitory, it's relaxing in the brains of patients with fibromyalgia, correlate with lower pain thresholds. Higher levels of glutamate, more incidence of pain, less ability to tolerate certain stimuli, right? And so you can see elevated levels of glutamate also contribute to fatigue and depression. So very, very interesting concept. Glutamate binds to receptors called NMDA receptors. These are receptors that essentially cause a channel to open from outside the cell, inside the cell, and allow calcium inside. And so this receptor, part of the way that it's activated is by glutamate. What I want to mention on this slide here is that in its normal resting state, the receptor is inactive. It doesn't participate in synaptic modulation because the ion channel's plugged. And it's plugged because you get the binding of magnesium and zinc, and that prevents the flow of certain other types of electrolytes through the channel. So you want to know a good way, a good secret to lower glutamate levels? It's by taking magnesium and zinc. But those two minerals, you can see here, magnesium is present when the receptor is inactive. If it's inactive, then we will not get this channel that's activated and so much stimulation of the glutamate. So it actually prevents the activation and can lower that threshold. There, in many cases, just like we talked about with stress, there seems to be a history of flu-like episodes, as well as where trauma, stresses, infections, or inflammation of the body someplace. Fibromyalgia has been reported to develop after Lyme disease in patients with HIV, hepatitis C, parvovirus, Coxsackie virus. It's also been linked to Epstein-Barr, which I think we talk about a little bit more. Human herpes virus 6, cytomegalovirus, and enteroviruses. So do we need to be measuring for viral loads in the body if a patient has fibro? Yep, absolutely. The top three that I probably would measure are EBV, HHV6, and cytomegalovirus because they're so heavily prevalent in our society. You can also be looking at the gut and looking for bacterial and parasitic infections, but I would say more often than not, we're looking at the viral causes. Influenza A may be a cause. When we get the flu, flu B is most common. There's a small study of patients with fibro showing that some of them have a higher prevalence of type A influenza. The last epidemic to invade North America was in 1978, named the Texas flu. So there might be some relationship between older adults and having fibromyalgia because they might have gotten the flu with type A. And most flu vaccines, interestingly enough, have multiple different influenza A virus um, uh, activation. And remember, most flu viruses are they're activated viruses, meaning that there are small amounts of the virus that cause your body to mount a response to it. And sometimes in some patients that can go the wrong way. EBV is present in more than 90% of the population. And there is some type of cross pollination between EBV and fibromyalgia. There is some type of serologic evidence to show that EBV can be reactivated in some patients with fibromyalgia. It's not always confirmed. And of course, the association between EBV and chronic fatigue syndrome and fibromyalgia is not established because it might not be for everybody, right? So that's why it's not established. It's not the gold standard. Long COVID. It can't have a conversation about fibromyalgia and chronic fatigue in this day and age without talking about long COVID. Approximately half of recovered COVID patients continue to experience at least one long-term symptom. And long-lasting fatigue is particularly common. About 28% of patients have fatigue. There are also other persistent symptoms like asthenias, dyspnea, pain, and exercise intolerance, sleep disturbances, other types of sensory disturbances, cognitive dysfunction, neurological and digestive disturbances. Well, that sounds interesting. That's a lot of the things we just talked about with fibromyalgia. And so there is some type of similarity between the two. Of the 29 symptoms observed in patients with chronic fatigue syndrome, 25 were reported in patients with long COVID. 25 out of 29. In addition, there's several articles that have linked EBV reactivations to the development of long COVID. So there's this kind of overburdened immune system that can reactivate Epstein-Barr that can potentially perpetuate the problem even more. How about the COVID vaccine? So increasing evidence now indicates that COVID vaccines are frequently associated with persistent sensory disturbances, including generalized sensory symptoms and pain, raising the possibility that the vaccination might have triggered somatosensory nervous system damage, affecting small nerve fibers. This has actually been, we actually now have a term for patients who have been affected by the vaccine in some way. It's called post-acute COVID-19 vaccination syndrome, PACVS. There is overlap. You see autonomic nervous system dysfunction, and you certainly see some of the type of dysautonomia that we see in patients with fibromyalgia and chronic fatigue syndrome. So this is an uncontrolled observational study of 15 patients with generalized sensory symptoms and pain after COVID-19 vaccination, found that all patients experienced widespread pain, and most of them, 11 out of 15, had a fibromyalgia syndrome. So there could be crossover or a misdiagnosis, right? Or maybe we'll just label it as fibromyalgia, but it could be related to something else, right? Including the vaccine. So that's something to kind of put on your radars, especially since, this is the day and age where this has happened more frequently.